Hello, everyone. Welcome, welcome, welcome to this special webinar event. I'm Amy Regan from FullScript, and I am so glad that you've joined us today. A few housekeeping notes. Please place all questions you have in the Q&A box for a chance for them to be answered at the end of the presentation. This webinar is being recorded, and the recording will be sent via email to all attendees and registrants. There is a copy of the presentation slides in the Files section. It is my great joy to introduce and share that Dr. Holly Lucille is with us today. She is a nationally recognized licensed naturopathic doctor currently practicing in Los Angeles. A dedicated educator and expert in the field of integrative medicine, she is a consultant, author, and media figure. Dr. Lucille serves as a senior medical advisor here at FullScript. Welcome, welcome, Holly.
Thank you so much, Amy. It's so great to be here. All right, we're going to get going?
Yes.
All right. Yeah, it's awesome. Thank you so much, Amy, for that. I'm so happy that you are here. I don't know about you, but in my inbox and around the circles that I run in, there has been a lot of content and webinars on this particular subject, and I'm really excited about that. So the future of menopause, breakthrough ingredients for whole person support. So we're going to be talking about it all. Yes. All right, next slide. So part of the reason why I'm really excited that not only I'm here with you, but you're here, is that I kind of feel like there's a tide changing from certainly my previous experience clinically and socially, and a lot about menopause in general. I think there was once where it was, and still is, but really medicalized and really pathologized. I mean, historically, menopause symptoms were diagnosed as hysteria, right? This was like kind of broad and vague diagnosis frequently attributed to women experiencing emotional and psychological and physical changes. And I think this reflected deep-rooted misunderstandings that still kind of are a tapestry running through our modern day menopause situation, and some medical bias as well. You know, kind of viewing menopause as a state of emotional instability rather than just this natural physiological transition. Yes, if we're lucky enough to live to and through menopause, this is a natural transition. I mean, the term hysteria itself is derived from the Greek word uterus, hystera, right? So reinforcing this kind of gendered stereotype about women's health. And I mean, I think if you really think about it, and I do love to think about things and use my mind, this natural phase of a woman's life was once honored, it was once celebrated. And I think it still confuses me a little bit why it's actually turned into a clinical condition that we actually have an ICD-10 code for, right? So just to lay a little bit of the foundation, we'll get more into, I think, where this messaging came from. So next slide. And this is just a quick reminder that this presentation is intended only for education and certainly not meant to provide any medical or professional advice. Next slide, Nat. So just a little roadmap of where we're going to go in the next 40 minutes or so. We're going to talk about menopause, what it is, you know, from a definition perspective, what I think it is, what it should be, and where the messaging I think needs to change. We'll talk about the difference between conventional versus comprehensive approaches, like any other quote unquote condition. And then really dive into some stories about reverence to renewal and how this phase, this natural transition, once honored, once celebrated, is still celebrated throughout history. And then go through some of the physiological and hormonal changes during menopause, because my patients are quite confused about what's happening, what they're experiencing, what's getting their attention. So I think that's very important. And of course, the role of the microbiome, we'd be remiss if we didn't talk about that, if we were talking about anything today. And then get into our evidence-based integrative support for this period for women, adrenals, nutrition, therapeutic botanicals, mind, body, spirit connection, and different activities, interventions, and modifications for all of those. And then personalized health approaches. And then I will provide you with a bunch of resources. And there also will be question and answer. And then of course, if we don't get to everybody's question and answer today, there will be a way for us to get those answered. So next slide. All right, let's start with a poll question. So how often, and the way that you can interact with this poll is right there on the slide. You can go ahead and just click whichever your answer is. How often do your patients bring up the topic of menopause during consultations? I mean, it could even be actually booking an appointment for this quote unquote condition itself. A would be very often, B, occasionally, C, rarely, and D, then never. So we're going to take a minute to just let everybody do this, and then we'll have the sort of live feed results in real time for you in just a second. So thank you for playing along, and just rest yourselves because there will be another poll at the end of this presentation. Okay, so how often do your patients bring up the topic of menopause? Very often, okay, 60%. And then occasionally 34%, zero we got with never, and rarely only 6%. Okay, great. So I'm super now happy that you are all here, because I see this and I see women who are definitely struggling through modern day menopause all of the time. And so let's keep going. So next slide. So, all right, what is menopause? Well, all right, from the definition, how it's defined, and we educate on this: 12 consecutive months without a menstrual period. Because what are we doing, right? We are going from this natural fertility phase after puberty, no hormonal transitions, into our fertility phase, and then that's winding down, and we're moving on to more of those wisdom years, right? So higher intuition, they're up, like if you think about the chakras, even like where your ovaries are kind of, all the energy is concentrated below the waist, and then there's a chance for women to tap more into their intuition and such. So typically average age is 51, happens between ages 45 and 55. Every single woman's, their journey is unique. And then I think what's fascinating to me is the number of postmenopausal women worldwide is steadily increasing. As of 2021, women age 50 and older made up 26% of the global female population, a notable increase from just 22% a decade earlier. So what does that mean? Well, for me, it means there's a lot of people that we get to care for and care and be with. But I also think it's a huge market still. I mean, I have seen things. I think I've seen everything. I had a colleague send me some ring that promised to, assuage all of modern day menopausal ills. And she was kind of irate about it and wanted to know the mechanism of action. I've seen bracelets and wearables, and certainly pajamas and bamboo sheets and all sorts of stuff like that. But I think menopause is way more than those symptoms that are getting people's attention, and certainly way more than hormonal charts or this idea of a hormonal imbalance, right? I think of it as a profound physiological and psycho-spiritual transition, sort of a natural, powerful unfolding of the body's innate wisdom. I think we need to get back there. It's not a disease. It's not a problem to be solved. Yes, quality of life is super important in our modern day, but it's not something to be managed with fear or shame. And I see this a lot, and it's mostly coming from women themselves. So I've had the privilege to almost do that thing where you learn one, do one, teach one. So I wrote a book in 2004, right before I was menopausal, called Creating and Maintaining Balance, A Woman's Guide to Safe Natural Hormone Health. And it was spurred off of the Women's Health Initiative and all of that. And back then I was like, this is a natural transition and we've got better ways to deal with it than just hormones. And then I went through it and I was like, I probably should have waited to write that book. I might have had a little better context. But so the learn one, do one, teach one for me, it was a change, it was asking me to be pulled inward, to pause, to listen, to reclaim part of myself. And I think for patients I work with, we always talk about this. Part of them that have lost themselves perhaps along the way, constantly kind of caring for others. And when you get into really learning about somebody's life, especially the decade prior to menopause. And we'll get into this when we talk about the adrenal access and how important it is. Women are caring for still, children that have not left the house yet. They're adult children perhaps, and also in that sandwich generation where they're caring for their elderly parents and sometimes have lost the care for themselves. But I do think it is a shedding, a reckoning, a rebirth. And yes, the body changes, but so does that soul. And we need to get in there and honor that again. And when we honor that, menopause, I think, becomes more of a portal than something to be diagnosed. It's a rite of passage. It's a return to our most authentic selves. And that's how I like to message it to my patients, for sure. All right, next slide. So I want you to entertain me a little bit about this, because I know we need definitely personalized menopause support. Obviously, with whole person care, there is no cookie cutter medicine going on, right? We've got to look at everybody's different. And menopause affects nearly every single system in the body. I think it's under-discussed the way that it really transpires. It's under-researched and often, like I said, medicalized and pathologized. So where did this come from? All right, I need to address where I feel that we got a bit off track. And I hope again, I want you to entertain me. Have you ever seen this book? Now, this book is called Feminine Forever, all right? This book launched 1,000 estrogen prescriptions and a feminist outcry. Now, I have it because I ordered it, and it's all tattered, and well, it's really old because it was written in 1966, the year that I was born. Because when I would lecture IRL in real life, I would take this with me and I would start it at the audience, and I would just have people open it up and just read a couple sentences, all right? I'm going to give you what happened here. So in 1966, Dr. Robert Wilson, who's a New York gynecologist, published this book, and it would shape the cultural narrative around menopause for decades, and it's still here. And Wilson, he wasn't a household name before this, but he became one thanks to a very clear mission: medicalize menopause and promote ERT. That back then, estrogen replacement therapy. It was a panacea for aging women. But here's the kicker. The book wasn't an innocent contribution to women's health, not at all. It was later revealed that Feminine Forever was financially backed by the pharmaceutical company Wyeth Earth, who manufactured what drug? Premarin. Yes. So it was essentially a ghostwritten marketing campaign disguised as a health manifesto. And the messaging, just brace yourself, because I'm going to read verbatim. Wilson argued that menopause was not a natural life transition at all. It was a deficiency disease, akin to diabetes, and that estrogen could cure it. Some standouts from the book I just want to read. Women without estrogen would become flabby, dull-minded, and unattractive. He promised that estrogen would keep women feminine forever, hence the title. Aging, in his view, was not only undesirable, but it was treatable. Yes, only if women stayed hormonally youthful. He even implied that menopause women without estrogen were less lovable. It's in the book. Less useful, and ultimately doomed to irrelevance. And why is this appalling? It's pathologized a normal physiological transition, framing menopause as a crisis, not a passage. It reinforced deeply sexist ideas about women's values being tied to youth, beauty, and reproductive utility. It conveniently ignored the risk of hormone therapy, many of them which weren't fully understood until decades later, right? So think the Women's Health Institute and all the other sort of data that we have. It manipulated fear of wrinkles to push a product. And in short, Feminine Forever wasn't just a book, it was a cultural weapon, right? Used to pathologize women's aging and sell a pharmaceutical fantasy. So here's a particularly jaw-dropping quote from Feminine Forever. And I think I've memorized this because I've said it so many times. Many of them, he was talking about postmenopausal women, are no longer feminine. Even their husbands admit they are not the same people. They have become dull and unattractive. So the tragedy of menopause is that women are condemned to living the last third of their lives in the state of chronic deficiency. So he sold the idea that menopause was a biological failure in need of correction, not a normal, powerful transformation through life. And I think that we so much need to understand where this came from and help turn it around to our patients and help really revise that messaging. So thank you for that. Feminine Forever, you can pick it up on Amazon. It's a great read. It's in the comedy section, I think. All right, next slide. So conventional versus comprehensive approaches, just a brief comparison. I always say there is value in all systems of medicine. And as per usual with any natural or clinical condition, there is a conventional way to care for it and a more comprehensive way. So One of the things I do want to point out here, obviously with more comprehensive whole person care, we're looking at that whole person, their life, their beliefs about this period. Very important to discover. Their diet, I'm getting more and more back to that because I think post-pandemic, people have gotten a little bit away from understanding what true nourishment really is like. It honors that whole psycho-spiritual transformation and bio-individuality, and it's definitely more holistic. Not that this webinar is going to focus much on hormone therapy, but I do want to mention it because, you know, I've seen HRT, right, hormone replacement therapy. I would argue that if it's a natural transition, there's nothing to replace. So there has been hormone therapy. There's been MHT, which is menopausal hormone therapy. There's been BMHT, which is bioidentical menopausal hormone therapy. You get my drift here. But what I've seen out there a lot for people that come into my practice is there's a lot of ready, fire, aiming going on out there when it comes to prescribing. That is what I've seen a lot. And I think that there's a lot of considerations that we should take into account before prescribing. And certainly in the idea of whole person care and integrative care and functional medicine and naturopathic medicine, using the least invasive methods to diagnose and treat first, this might be up there just a bit. But I think there's a lot of considerations like COMT genotyping, right? So that influences estrogen clearance, methylation capacity, estrogen metabolism in and of itself. And obviously we know that there are great functional medicine tests that I'm going to tap on just a little bit later in this, just briefly. And then assessing, you know, the 2-hydroxy, 4-hydroxy, 16-hydroxy estrogens, and then phase 2 conjugation. And so I think that exogenous therapies definitely can provide some relief to menopausal symptoms, but the individual definitely needs to be assessed. The devil is in the details. I've always said about medicine once I started practicing, I don't think this is really rocket science. I was pretty amazed about, you know, cleaning up somebody's lifestyle, dietary interventions, some of the least force and, you know, interventions that we can do. And people in my practice really started to feel better. And I was having a blast. But when it comes to the endocrine system, I think it's just the opposite. I think the devil is in the details. And we really have to understand that. One of the reasons that I talk about this quite a bit is my own story. I was working I was working in an office and they did something called age management. I'm like, what do you do? And they're like, we'll take you to the program. And I went through menopause around 45. So I was between 45 and 50. And so I went through the program, got my blood drawn, and like, here, you should be on all this. And I was like, I did it, you know, and I take complete responsibility and I felt great, right? And I developed breast cancer. Now, am I saying that there was a correlation between that hormone exogenous therapy and my breast cancer? Well, my breast cancer was driven by, you know, ER positive, PR positive, but also after my breast cancer journey, I did start to realize and dig a little deeper into my own individual self. And I'm a really quick metabolizer, and I've got some genetic SNPs that probably would have helped us understand how to dose a little bit better and be a little bit safer. So full responsibility, not blaming anybody or anything, but I see those stories playing out all of the time. So that individualization really needs to happen. Okay. And then next slide. So also just coming from reverence to renewal and looking across cultures and how this period was once honored and sacred, right? So deeper wisdom, like in the Lakota tradition, the Moon Lodge gatherings weren't just for menstruation. They were sacred circles with postmenopausal women. And, all right, sorry here. Whoops. I lost my slide. Apologize for that. And these postmenopausal women were revered as spiritual leaders. Also then in traditional Chinese medicine, this was like menopause is the conservation of the life essence. It isn't a decline. They saw it much more as refinement. And in Ayurvedic medicine, menopause marks the rise of the vata, the energy of space, air, and intuition. And then also in ancient European customs, the ancient European elder women were midwives of both birth and death, keepers of deep knowing. So as we aged in these cultures and in these ceremonies, women were the ones that were looked up to and really revered into renewal, into the last third of their life, which was so much more into that wisdom and intuition phase. All right. Okay, so next slide. So I think there is a modern disconnect today then, right? Because we aren't thinking of it anymore. I do think, like I said at the beginning, that the tide is turning, but I think very much I see aging being stigmatized, especially for women, that rituals and this wisdom piece have faded. There's a growing disconnect from these natural cycles and rhythms. This is nature we are talking about, right? And it's a natural hormonal transition. It's not hormonal imbalances. It can't be confused, the two, and lead to unnecessary fear and overtreatment rather than just being informed and having supportive care. And I think that's where our knowledge about it and our ability to impart that knowledge through education to our patients is so important, right? Docere, doctor in Latin, means to teach. And I think that's extremely important. So next slide. So we do have an opportunity to reclaim menopause as an empowered rites of passage and reframe it as a threshold to insight and creativity and freedom, and build modern circles of support and storytelling, going back sort of where we were once and bringing it all the way forward, and integrating the body, the mind, and the spirit through these holistic approaches and lifestyle modifications. And let's let menopause become people's intuition, not a decline, right? Not into decline, I should say, but also into power. All right. Thank you for that, because I think it's really important to set the stage of where we've come from. I do think it affects how women go through this transition. So let's talk about menopause and its very complex hormonal recalibration. You know, I've said it so many times. It is a physiological shift. It is an endocrinological shift. It is a social shift. It is a spiritual shift. It's a lot. I mean, the obvious estrogen levels do drop, which impacts everything from temperature regulation and collagen production to brain function and skin elasticity, right? I think one of the things that is understudied and underreported, but most significant changes, is estrogen's effect on insulin sensitivity and blood sugar regulation. And that becomes more challenging and contributes to increased fat storage, especially around the abdomen, right? So again, women pathologizing themselves, saying, oh, my menopausal middle, right? Or they've, lost their keys or forgot a word. Oh, my menopausal mind. That's the modern day sort of reflection on where women think they are, as sick people during this natural transition. Now, progesterone, of course, declines, and that often happens before estrogen, and more steeply than estrogen. And this impacts GABA receptors in the brain, leading to increased anxiety, irritability, and disrupted sleep, particularly early waking and difficulty falling back to sleep. So we see that as a clinical presentation often. Testosterone levels may fluctuate and also decline, affecting muscle mass, bone density, libido. Also, some women may have experienced increase in testosterone relative to the changes that are going on with progesterone and estrogen. So they'll get a little bit of that acne or increased facial hair. You've got follicle stimulating hormone, luteinizing hormone rise in response to ovarian resistance. Now, it's funny because, well, it's not funny, but I have seen this framed before and diagnosed as ovarian failure, right? So, our ovaries failed. I mean, like, do we then frame puberty as ovarian success? Like, I'm just like, how did we get here, right? And then cortisol may become definitely dysregulated as well, especially if that person, not only going through this lovely transition, has been under, chronic compounded, confounded stressors, or poor sleep is present and things like that. So you're going to see more of that fatigue, belly fat, and mood swings. So next slide. Some common symptoms we all know about: the vasomotor symptoms, sleep disturbances, weight changes, cognitive changes, sexual health, these things that I've just talked about, urinary health, mood swings and irritability, and then also just this sense of well-being. I know that every time I have had a vasomotor symptom, whether it is a night sweat or a hot flash during the day, what precedes it, and this is what I hear clinically from my patients as well, is a period of anxiety, like doom, like what is going to happen. And then I have the little vasomotor symptom happen and I'm okay. I'm like, okay, it was just that. But it can be very unnerving for people if they don't understand what's going on. I do want to just brush on some less common or more obscure menopausal symptoms. Burning mouth syndrome. I have seen way too many times, and this is like the sensation where your tongue, your lips, your gum or throat, it's almost like this scalding sensation. You can have a swollen tongue as well. Hoarse-like or deepening voices can happen. There's a sensation that bugs might be crawling on your skin. That's often estrogen related. Dry eyes or vision changes, joint pain and stiffness, right? Because estrogen does play a role in joint lubrication, hair texture, digestive changes, altered gut motility. We'll talk a little bit about that when we come to the microbiome. Changing microbiota because of all of these influences, and bile flow due to hormonal drops, allergies that are worsened or there's a new onset, and then itchy ears or genital itching without obvious infections I've seen happen, and also heart palpitations or skip beats. Hormonal fluctuations, especially in early perimenopause, can lead to this, even in the absence of any heart disease whatsoever. All right, next slide. So let's briefly talk about the role of microbiome in menopause. Next slide. So it's interesting for me to have all this incredible testing available at this point in time. And also when I graduated from school, so Southwest College of Naturopathic Medicine, now Sonora University Health Sciences, 2001, we hardly were talking about the word probiotic, not to mention microbiome, right? So I don't think it was until the Human Microbiome Project I think that was in 2007, right? That was the project that focused on understanding the diversity and function of microbial communities that live in and on the body, and how these communities, relate to human health. And it's been amazing. And I know we're all kind of blown away. And so I think of the estrobolome as, it's a subset of gut bacteria, collectively termed the estrobolome, produces beta-glucuronidase, which is the enzyme that deconjugates estrogen in the GI tract. So sometimes at phase 3 of estrogen metabolism. And this activity influences circulating estrogen levels by determining whether estrogens are reabsorbed or excreted, right? So if you've got beta-glucuronidase that's elevated, you've got that glucuronic acid that is bound to toxins and estrogen. And yes, weirdly enough, our body looks at estrogen as a toxin and helps metabolize and get it out. If you got that beta-glucuronidase that's elevated, it will cleave that bond, and then that recirculation and provocation of estrogen continues to happen. So if there is a element of dysbiosis, right? So imbalance, reduced microbiome biodiversity, increased pathogenic load may result in estrogen excess and or deficiency, depending on the clinical context. And so that is the estrobolome. And then next slide, please. So when this happens, poor microbial balance contributes to low-grade systemic inflammation, which then impacts the hypothalamus pituitary adrenal axis, also thermoregulation and cognitive function. Also, elevated inflammatory cytokines may exacerbate vasomotor symptoms, mood disorders, and bone loss. I mean, if you think about inflammation, I think there's a word called diapedesis, right? So think about those and blood vessels, right? So diapedesis. And also think about some of the interventions, especially from a food perspective, when people are suffering from hot flashes or vasomotor symptoms. Reduce alcohol, spicy foods. Then that there is a connection, because again, this hole that starts here and ends back there, unbelievable to next, sort of for me, second next to estrogen being sort of viewed as a toxin, 1 cell thick, the whole thing, right? So even if we have any disruption, not only in the microbiome itself, but I think that gut permeability, we're going to have an uptick in those vasomotor symptoms. And I've seen that clinically so much. All right, so next slide. So in whole person care, I think that things like this, lifestyle modifications or interventions, are vital. I mean, this is truly the least force, right? The least invasive method to care for, at least for part of the solution to our modern day menopause. So if we think about microbiome strategies, stress management via heart rate variability training, breath work, and mindfulness-based stress reduction has been shown to positively affect microbiome diversity and the gut-brain axis. So when I'm starting to get into the rest of the latter part of this presentation, I will tell you that in working with people that come in and menopause in our modern day is getting their attention, the things that I put in place or we do together and talk about as far as the care plan, it is a lot. This is not a pill for every ill at all. Even though we're going to talk about incredible ingredients, it is definitely one of those things that is like synergistic, right? A little bit of this, a little bit of that, 1 + 1 = 10. And people start to feel better, their quality of life is there, and they really do get to enjoy these golden years, these wisdom years, these higher intuition, these crone years for the most part. And also the tincture of time. I will say that. Okay, next slide. Also diet modifications. I'm kind of a food first kind of gal. And there are, of course, ways to test these estrogen metabolites. We could also, out of diindol methane that comes from this cruciferous vegetables, if things are sort of sorting towards the 4-hydroxyestrogen, we talk about magnolia, and of course, more precision probiotics, but that all is going to be saved for another webinar for sure, because we could spend many, 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 many moons, moments, and slides on precision probiotics when it comes to the microbiome and menopause. Okay, next slide. Let's talk about a little bit the adrenal health and stress management piece. I've always said that I think that our adrenals, kind of step up to the plate when the ovaries take a well-deserved break. And one of the assessment tools that I use to understand where a woman is in her modern day menopause is, tell me about the last decade of your life. And the stories that I hear are pretty amazing. I mean, they're notable for sure. They're remarkable for sure. We've all lived through the pandemic. That was a lot for everybody. But then upon it, there are individual circumstances that are amazing. And people need to be cared for because it, right? So after menopause, in a very natural way, the ovaries kind of take that well-deserved break and the adrenals come in and they can produce these small amounts of estrogen and DHEA, and all of these influence our mood and metabolism and energy. And I know people in my life and in my practice that have gone through this incredible transition and maybe had a hot flash, maybe had a night sweat, didn't have a lot of the things that we're seeing across the board, but their lifestyle also sort of showed that that's where they're going to head during this transition. They did it and they did it right. They walked their talk, and they were ready for a transition, right? I'm about to move to another state, and preparation is everything. And if I wasn't in good shape mentally, physically, emotionally, financially, that transition is going to be so much harder for me than being prepared. And so I'm taking the time, just a little analogy, to be prepared to do so, and hopefully setting myself up for success for a big move in the last third of my life. And so same thing with menopause. I've seen it before. And so that adrenal health is so important. Next slide. Because cortisol, obviously we know it as quote unquote the stress hormone, and that's how our patients know it most, but overworked adrenals, more severe menopause symptoms. I've seen it in the data. I've seen it with my patients. Elevated cortisol, you're going to get more hot flashes, insomnia, weight gain, anxiety. Low or erratic cortisol, fatigue, brain fog, burnout. All of those quote unquote menopausal symptoms can certainly overlap with adrenal insufficiency. And so very important piece of this picture. Next slide. So other tools besides just interviewing folks, I think the adverse childhood experience, the ACE score, I think that work was done in the 70s, but boy, it's something I use all the time. I think it's relevant to how people are responding to their chronicity of health in the modern day. There's the menopause rating scale as well, and also the perceived stress scale. Those are just a sampling of tools to consider when we're working with people and understanding how our interventions are going to be tapered. All right, next slide. So then let's get into the integrative support for menopause from a, next slide, evidence-based nutraceutical and botanical perspective. So ashwagandha. I don't know if a lot of people think about this when it comes to menopause, but there is strong clinical evidence supporting the use of ashwagandha, about 600 milligrams per day for comprehensive menopause symptom relief. And largely, why? What's the mechanism of action? Well, the HPA axis regulation and stress hormone reduction. Additional perks I've seen include better sleep, mood stabilization, and cognitive clarity, all highly relevant to menopausal wellness. Next slide. So black cohosh, right? So works on serotonin and dopamine receptors in the brain, been along for a long time. Clinically studied, commonly used for menopausal symptoms, mostly with vasomotor symptoms in mind, but also mood swings, sleep disturbances. One of the things I think, and I mentioned it before, tincture of thyme, with most of these ingredients that I'm just going to review, this is not an overnight solution. Clinical guidelines recommend a dosage 40 to 80, often in divided doses, with therapeutic effects typically starting around what? Week 2. That's an important piece of education, right? Because if you are recommending this and someone goes home and 3 days later they're like, I am not better, and of course they're still stressed out and they're still drinking alcohol, and they're still, their diet is off, it's like, why doesn't this black cohosh work? Well, first of all, we need everything together in that whole person synergy, but also maximum benefit by about 8 to 12 weeks. And I think that's another piece of an important education. And mechanistically, insights are still emerging on this. I mean, evidence suggests that black cohosh does not significantly modulate cortisol or the HPA axis. Instead, that serotonergic pathway and maybe selective estrogen receptor modulation, kind of like a SERM-like activity. Even the central opioid system can be affected. There's one PET scan study that I found, and it found changes in opioid receptors binding after 12 weeks of treatment. So again, key take home, while black cohosh can be effective, it needs sustained use, typically 2 to 8 weeks. And so big piece of education. Next slide. So Chastry, again, has been studied for menopausal relief, especially hot flashes, anxiety, and mood, and also has a long-standing use in what? Progesterone support. We know that. But also mechanistically, lowering prolactin through dopamine D2 receptor activation, and thereby modestly increasing progesterone and balancing reproductive hormones. And that's so important. It's slow acting. Again, clinical effects usually begin around 4 to 8 weeks. So another piece of education, and full benefits at 12 weeks. And so super important. And this is one that I start with quite early with people. It requires sustained use though over time. And then our next one. So sorry, next slide. So rhubarb extract, often standardized as ER731. This is a selective estrogen receptor beta agonist and is derived from the roots of rhubarb. Long-term observational data across 6 months actually confirmed sustained benefits. Now, again, long-term, with average MRS, so that's the menopausal rating score, dropping nearly 50% from 14.5 to 6.5, and also with an excellent tolerability rating. So this is a very important, I think, very effective ingredient. What does it take? The tincture of thyme. So initial hot flashes can begin to reduce within a few days. But again, just that piece of education and tincture of thyme. And the next slide. This is another one, I think, along with ashwagandha, not really thought about, but saffron. Has really promising effects in managing those psychological menopausal symptoms, which once we correct those and assist with those, I think can help across the board with everything else going on, notably mostly anxiety and depression, though not vasomotor symptoms like hot flashes. And I think that's an important distinguishment. There was a 12-week randomized controlled study among perimenopausal women taking 14 milligrams twice daily, led to a 33% drop in anxiety and a 32% reduction in depression scores compared to placebo. So again, I would say mood stabilization I see by 12 weeks, and benefits, though, psychologically start being seen between 4 and 8. Very well tolerated, but again, takes time. Next slide. So those ingredients, and you're going to get the slides so you can review them. Biggest thing I will say, besides ashwagandha, is everything else takes a bit of time and really is supportive to all the other things from whole person care that we're talking about, including dietary interventions. So the Mediterranean diet keeps getting, I think, so many accolades and is being really studied now for the work in these really strong phytonutrient content foods in longevity, right? And younger people just having younger biological ages, like the blue zones and such. But those rich and colorful vegetables, fruits and grains, olive oil, fish, legumes, the Mediterranean diet significantly reduces menopausal symptoms, especially hot flashes and mood disturbances. And this might be a surprise for you, but the dietary approaches to stop hypertension, the DASH diet, right, originally designed to lower blood pressure, but it does emphasize foods like vegetables, fruits, low-fat dairy, lean proteins, whole grains. So, and for menopausal women, this balanced approach helps manage weight gain, mood swings, and hot flashes. All right, next slide. So, as I said before, I'm a really foundational food first kind of gal when it comes to me being a practitioner. And these interventions and going back to the basics of even macros, kind of non-negotiable for me any further. And as I said, my trend that I see is that post-pandemic, people's quote unquote diets, when you look up diet in the dictionary, it actually means habitual nourishment. So how, as a habit, do people nourish themselves? And that's the way that I like to look at it. That's the way I like to talk about it. And that's the way I like to frame it. Because nourishment, somehow, some way, through everything people have gone through, has gone out the window. And when it gets down to brass tacks, people are not nourishing themselves very well. And it's so imperative during this process. And so there are plenty of ways to track this. Sometimes I just have people like, look, it doesn't need to be fancy. You bite it, you write it. I want 3 days, including a weekend day. And I sort of just say, I'm not going to judge. I don't want you to filter. This is just for me to have data so I can help you feel better. And what I'm seeing these days is just blowing me away. It's unlike anything else. And so getting back to those macros, people are not eating enough protein. And a tip there, encourage patients to aim for a balanced plate with approximately 20 to 25% of calories coming from protein. Obviously, this is all individualized. 30% from healthy fats, and those complex carbohydrates are super important. All right, next slide. And then, of course, there are certain foods that can offer extra support. We all know about phytoestrogens. I do get a little bit of pushback from people sometimes with the misunderstanding. Oh, my doctor told me because of this, that, or the other thing, I shouldn't have any phytoestrogens. And what I'll tell them is like, well, if you're thinking about estrogen stimulation, you know, our steroidal hormones are very strong, right? So they're steroidal in nature. These are phenolic in nature, right? And 1/1000th to 1/10,000th the strength, and can actually act as an adaptogen in a sense, right? Or block stronger estrogens or xenoestrogens from our environment. And then cruciferous vegetables, cannot say enough about them in their support of estrogen metabolism and detoxification. All right, next slide. So rounding out our whole person care, physical activity and movement as medicine, again, honestly, you know, I feel like when I go into the research and the data about the ingredients, it's kind of the easy part, right? I know, like the daughter of 2 pharmacists, here, take this, is an approach that I was well versed in. And those are super important. But like I said, in my opinion, the way that people have gotten really healthy and empowered through this natural transition is, yes, those good evidence-based strong ingredients that nature provides, but it is also dietary intervention. It is this physical movement. I mean, the physiological effects from bone density, right, to muscle mass preservation, cardiovascular health, metabolic regulation, neurological and psychological benefits, neuroplasticity we're talking about, supporting brain-derived nootropic factors, anxiety, depression, brain fog, sleep architecture. All of these things are so important and are important because physical activity and movement as medicine is a recommendation through this time. And again, I've seen people that have been active most of their lives, but for some reason they have fallen off. Now, quite busy, like I said before, caring for people younger than them, their kids still, their aging parents, and they've just kind of taken the finger off the pulse, the eye off the prize of their own health and well-being. And then you add in a very distinct, profound transition of menopause, and women are not feeling well. So all of these things have to be identified and come back to play. All right, next slide. So resistance training, I think if you're on Instagram or any social media at all, you'll see and hear that. I mean, that's where it's at. It just is. It's unbelievable. But I love it because the best metabolic thing that you can do, I think, as we grow older, is build muscle, right? So 2 to 3 sessions per week, emphasizing progressive overload. I always call in the professionals. I love when people can at least get 3 sessions with a personal trainer, personalized trainer, where they can understand proper form so they don't get injured, so they can keep their skin in the game, what progressive overload feels like and means. Also then adding in aerobic activity and flexibility and balance training, all of that. So as a level 2 CrossFit coach, as I started to wind down my quote unquote CrossFit career, I had a 3M sort of mantra, which was modification, moderation, and mobility. I do 2 out of the 3 of them very, very well. I don't mobilize 2, but it's always in retrospect. But do what I say, don't do what I do, I guess. All right, and then next slide. So also the mind-body-spirit integration. This is something that I talk about a lot with my patients. Their emotional health, especially when they're not feeling physically well, cognitive health, social connections, and encouraging supportive relationships, getting them out and getting their friendships renewed again, rebuilding that quote unquote village, right? Menopause is not meant to be walked alone. Talking about themselves in a way that honors the spirit of this transition instead of the medicalization and the pathologicalization of it. That's not a word probably, but you know what I mean. Really important to be supportive to each other and be there to pick up the phone if somebody's just having a down day. And we're all going through it, right? So emotional, cognitive, mental stimulation. These days, the wearables and the apps that can really, right? So we talk about our smartphones. Can we use them for good or evil? You can usually use them for good in a lot of different ways. As I said, with the food log, you bite it, you write it, but there is things like Chronometer, which is very easy to put in your food. There are brain games that can be fun and engaging for people to take 5 minutes out instead of, what do they call it, doom scrolling. They could actually just pick up their phone, stimulate their brain a little bit. And then also, tough sometimes to talk about clinically, getting back to their spiritual health. And for everybody, kind of from a practitioner's perspective, I'm always curious about what it is for them, because we definitely have to tailor that talk. But all of this mind, body, spirit integration, along with physical movement and food and our evidence-based ingredients, are super important in a healthy menopausal transition in our modern day. And next slide. So obviously, I mean, again, I graduated in 2001, and the specialty lab testing and precision medicine that can go on because of these functional labs, just amazing. We've got the hormone panels, including your estrogen metabolites, progesterone, testosterone, sex hormone binding globulin, right? The brain is pretty smart. So when I do get people coming in on super physiological doses of exogenous hormones, usually I know that sex hormone binding globulin is trying to do its job. And it's like, I think that's a little bit too much for your age, and they're going to bind it up. And if they go back to their practitioner, whether they're not feeling well or testing their levels, and they're not testing sex hormone binding globulin, well, what are you going to do? Usually I've seen it before. They're either going to change routes of administration or they're going to increase the dosage, all not doing anybody any good. The Dutch testing and other tests like that, microbiome analysis, cortisol testing, so we can actually understand the HPA axis and perhaps clinically where somebody has been in that last decade or so or beyond. And then those genetic, in the words of Ben Lynch, my friend who wrote Dirty Genes, we can't treat SNPs, but gosh, it is really clinically awesome to know what the genetic predispositions are. And they might not express themselves, but especially when it comes to this process and estrogen and hormones, we can put this whole picture, all the little puzzle pieces together and fit it really lovely into a positive and healthy transition. So next slide. Okay, and then next slide. So as always, at Fullscript, you will find a lovely, beautiful support protocol, and you can access it right there on your screen by that link, and you are also going to get it sent to you. Okay, we won't go in app. It is an app. We won't go in app right now, but you can access it there. Also, next slide, these other resources: comprehensive menopausal support protocol, patient guide to menopause support, beautifully laid out. Anything like that really helps, and I encourage people to look at it and read it. A webinar of supporting vaginal health in menopause. There's a webinar, menopausal transition, 3 categories of discomfort and managing their relief. And then also the menopause support protocol that I just showed you. Again, you can access these right here off that slide. And thank you so much. We're going to go to next slide. Before we go to that poll, actually, let's just do this poll question. All right, we got a poll number 2. Take a deep breath, and I will as well. So what I want to know is, did you learn something new today that you feel could enhance your clinical practice? You'll not hurt my feelings. We're always wanting to get better at delivering content, especially when we're talking about such an incredible transition and clinical condition of menopause, but looking at it from a whole person perspective. So A, you learned several new things. B, somewhat picked up a couple of insights. C, not really, mostly a review. And then D, this content was not going to apply to your practice. And then I will, okay. I'll give you a couple more minutes. And they're coming in. Okay, so I think you see it right there as I do. We've got it's toggling around 60%. I'll just say that you learned several new things. So I appreciate that so much. 0 said that it didn't apply to your practice. And so yay, we're all going to be out there caring for women in a much more holistic, whole person way, and inspiring and definitely getting that messaging rewired for people. Okay, and now I am here to take any questions and answers. Okay, so a couple of them here. And again, what I'm going to do, hey, can we just go to that? Actually, all right, no, I'll do this first. Change my mind again. So questions from the audience. How much Chastry per day? So per the data, 20 to 40 milligrams standardized extract once per day. And again, I will always say this tincture of time, that 12 weeks, I think, is the magic mark. So I always have people, we note the day, right, that I'm making the recommendations. And I want them to note the day that they are actually taking it. And then also we look at the calendar. I'm like, I just want you to stay the course. We can check in for sure, but I want you to stay the course. How much of the rhubarb? 4 milligrams per day. Got you. Okay. And then how much for the saffron? Basically from the studies, if we just look at it all, 15 milligrams twice daily. And then also you can find all the details of those ingredients in the protocol, right? So any questions about dosage, and everything's well referenced. In fact, the end of this slideshow, you'll see all of my references there. Should one continue these recommendations through postmenopause? That's a great question. And follow-ups are really important for me. They're my sweet spot for people. I like to see what we've done together, how the plan in process has worked. Has it made a difference? And so I also think less is more. And if somebody goes through menopause, is not symptomatic, has done some more of these lifestyle things, dietary interventions, gotten their stress down, perhaps there's not a need. What time of the day? Honestly, for me, this is an individualized thing. I don't think that any one of these need to be taken in the morning, the afternoon, or the evening. It's when does it work where there can be a better adhered plan, right? So I always think that there's a difference between compliance, which is, oh, she said do this or recommended that I do this, and adherence. Adherence is a faithful attachment to something. So if it's, twice throughout the day, then we want to make sure that it fits with people's schedule. So you can find the protocol. It's in your FullScript account, but also FullScript is going to be sending it out via email to everybody that attended this webinar. So thank you so much. Okay, are all of the supplements discussed safe in conjunction with bioidentical menopausal hormone therapy? Absolutely yes, right? Because sometimes if I don't know, a contraindication, right? Or I'm not using a database. Like I care for a lot of people with breast cancer because my experience with standard of care was so underwhelming. I was like, I have got to get in there and help. And so I use a database to make sure that there isn't a contraindication from anything I'm recommending on the natural side, or if there's optimizers. But when you think about your hormones being something natural that's flowing through your body anyway, you know that they're going to be there. So it's going to be pretty safe. So yes. All right, what is your opinion of HRT, hormone replacement therapy, or hormone therapy for perimenopause and postmenopausal women? Who are the HRT candidates and who are not? Obviously, that is something that needs to be assessed on an individualized basis. There are a couple things that I will not recommend hormone therapy until I know more of those genetic SNPs that I talked about, COMT, the methylation capacity, what your body is doing with estrogen through phase 1, phase 2, and also phase 3. So we're looking at the gut, we're looking at the liver, and we're looking at genetic variations that can really tailor our recommendations when it comes to hormones and make it, an effective recommendation because people feel better, but also something that's safe. What about magnolia bark? So I mentioned it. So diethylmethane for my training is used. So if 16-hydroxyestrogens the estrogen metabolism is swaying that way, diethylmethane from cruciferous vegetables, really, really great to be put on board there. But if it's 4-hydroxyestrone, actually magnolia works a little bit better there. So that is where I had mentioned that. And I think that's about it. Oh, I've got one question that's more personal. Can you answer the question about who you use to evaluate your genetic hormone processing methylation? I've had mine done overall, but looking for who can assess hormones in context specifically. I'm also okay. So there's a couple things I want to mention here. I use a test. There's great tests out there. There is a nutrition genome. There's the 3x4 genetics, and also if you have raw data from your 23andMe or Ancestry.com, there's a website called Genetic Life Hacks for I think $15. You can upload your raw data and get a cheat sheet, and all of the cheat sheets will show you where your vulnerabilities are, and they'll also link to an evidence-based article. Okay, I am out of time. I wish we could see each other IRL, but thank you so much for spending this with me. I appreciate you all so much. Next slide, if you would, because I think it's important that if you are looking for more assistance, or if I didn't get to a question, or if I talk too darn fast, I apologize, but you can always go to support@fullscript.com, okay? And then for questions about the presentation, you can always reach out to education@fullscript.com. Thank you so much for being here. We'll see you next time.